welcome to today's edition of the program NAFDAC and Your Health, where you get weekly and authentic information about NAFDAC's diligent work in safeguarding health. My name is Tosin Omolaja. On this edition of the program, we turn our spotlight on personal protective equipment required in safeguarding the health of the nation against COVID-19. NAFDAC and Your Health spoke with the Director General of NAFDAC via phone, and she discussed several initiatives the agency is working on at this time in fulfillment of its mandate of safeguarding the health of all Nigerians against this raging pandemic.
NAFDAC by mandate is supposed to control the manufacture, the use, distribution, sale of so many regulated products. We have 7. And one of the 7 is medical devices. And medical devices includes PPE, masks, gloves, things like that. So what we have done in NAFDAC is to start giving emergency use approval as stipulated by WHO to qualified companies that make these medical devices. One of the ones that I should include is test kits for COVID-19. But coming to just masks and protective clothing, these are things that people have to wear, whether the medical practitioners, nurses, healthcare workers, or the general public. They need to wear to protect themselves from one infection or the other. That's just general. The barrier mask is a non-medical mask, and that has been shown to reduce the spread of infection. And that is the type of masks that you and I will use. The medical masks are used by those working in a healthcare setting. There are different types of masks, like I mentioned, the medical and non-medical. The non-medical masks are very important to us at this point when it is being made compulsory to wear, and for a good reason. It is being made compulsory to protect the person next to the wearer from any droplets or fine particles that come from talking, to protect them from getting to the next person. It also protects the wearer, or it should protect the wearer from anything around him or her. So it is extremely important for non-medical masks, or the type of mask that you and I will use, barrier mask, to be made of good material. So not all non-medical masks are the same. It depends on the type of material. The material that is used can be any type of fabric, non-woven wadding, 100% cotton most of the time is used. Polyester, linen, or knit fabric can also be used. But for somebody to be sure that they are wearing, that the mask is protective enough, the thickness is extremely important. And NAFDAC is going to be testing that, not because we're supposed to, but because we want to safeguard the health of our own people, so that anybody that is going to be making masks now will know that they should choose the fabric carefully. If somebody has a barrier mask on and another person lights a cigarette lighter, for example, and that person can blow that cigarette lighter off, the barrier mask is not protective enough. If the person cannot blow that cigarette lighter off, then it is protective enough. It's a simple test, and I believe that people can easily do that. We are very good at making sure that things are okay if we are guided well. The medical masks, we have different types of medical masks. You have the surgical masks. The surgical masks usually are loose fitting. I'm talking relatively speaking, compared to the other types of mask that I'm going to talk about in a second. They are loosely fitted, but it's to protect healthcare workers from the patient that they are treating or taking care of, or also to protect the patient from the healthcare workers if there's any droplets or bodily fluids that contain germs. Then you have the respirators. The respirators have more what do you call it? Preventive attributes to them, in the sense that they filter out the particles coming in. The first one is N95. N95 masks filter out at least 95% of very small particles that may include virus from coming to their nostrils. If it is properly fitted, the N95 is tighter compared to the surgical mask. It is tighter, it fits snugly around the nose and the chin. So that is N95. Then you have the N98 mask. The difference between 95 and 98 is that 98 filters more particles out. It filters 98% of the particles from getting to the wearer. Then you have the KN95, which is the Chinese version of the 95, N95 mask, rather. So these are the different types of masks that are there, but we have 200 million people in Nigeria. Almost 200 million people will need the barrier masks because most Nigerians are not healthcare workers, just talking relatively speaking. That is one of the reasons why we lay emphasis on the barrier masks that you and I will need, that it is made with material that is thick enough, that is not irritating, because there are some materials that will cause itching. Some people are sensitive to different types of materials. We're going to continue to do this enlightenment because our people need it. In fact, it's already on some Twitter handles. We're going to put it on social media because we need to be aware. And the good thing about this is that if you bought a PPE that doesn't work, because you cannot be using one anyway every day, so you have the chance to get another one thick enough. You don't know, now the buyer will be more careful in terms of the material.
Local production of certain PPEs have already become rife, especially of non-surgical face masks. NAFDAC, apart from educating the public on standards for the production of these PPEs, have also begun, even before the emergence of the pandemic, to put in place technological platforms that will improve and encourage more participation in local manufacturing in Nigeria.
This pandemic, I believe, is teaching us a lot of lessons. One of the biggest lessons I believe that lessons that this pandemic is teaching us is self-sufficiency. We left everything and depended on consuming what others make. Now we are learning very fast. Our industry died, literally. Now I believe that they're going to be waking up because of COVID. Yes, there are many companies, several companies, not many companies, that are making PPEs. And NAFDAC is working alongside these companies to guide them right in terms of the standards, because you have to make it to standard. If not, if it doesn't work, there will not be buyers. But if you build it well, people will come. And that is what we are trying to also teach our local companies. And it's not just PPEs, it's everything. Our drugs, we import 70% of our drugs. Now we are thinking of, increasing the locally made ones. NAFDAC is working on that.
Let's take a short break. Stay with us. Welcome back. If you're just joining in, you're watching NAFDAC and Your Health.
The agency continues to find new ways of improving access and participation of more new organizations, especially in the MSME sector of the economy, in local production of regulated products. One very important development is electronic applications. Although the agency has been deploying this for a while now, it is set to take it to a whole new level.
MSMEs is extremely important to NAFDAC. Why? Because we have thousands and thousands of micro small businesses in our country, and they are the ones that drive the economy. So NAFDAC is planning to launch a palliative movement to encourage as many MSMEs as possible, micro small, to register any product that they think they can do well. And what we're going to be doing is we're going to give a huge incentive, meaning we're going to decrease our registration fee, not because NAFDAC has the money, but because we know that by decreasing the registration fee, more people than expected will register. And we give opportunities for people to register easily. We will assist them because from the end of the second quarter of this year, there will no longer be long hand filling of forms. We are already setting up e-registration. We will continue to perfect it. However, we want everybody to do e-registration, and we're going to launch it big by God's grace. We're going to assist our people that may not know how to use computers to use computers. So that is going to be one thing that we also can contribute to the Buhari administration that is so big on job creation.
Herbal medicine is one other area that NAFDAC has given a lot of attention and indeed had been working tenaciously to upscale.
Before I joined NAFDAC, maybe the last 4 or 5 years, before I joined NAFDAC, I devoted a lot of my time to do research on herbals, in particular, a herbal medicine that is effective for sickle cell anemia. So I brought into NAFDAC this freshness of the importance of herbals, herbal medicinal plants in our lives. So last year, March, I inaugurated the Nigerian Herbal Medicine Product Committee, HMPC, that is made up of researchers and herbalists or practitioners, because the goal is to bring the two together, because without adequate research, we may be assuming too much about herbals. We did another meeting last October, I believe, October or September, as a follow-up, and we are planning another one very, very soon. In fact, next week. Why? Because we have a rich biodiversity. God has blessed us with rich biodiversity that have medicinal plants. In terms of COVID-19, we don't have any product that was submitted for evaluation to be listed, particularly for COVID. There have been claims of, herbal medicine that will cure COVID-19, herbal medicine that is vaccine. None of these have come our way. And what we need to get used to is to think science, to think testimony, to think evidence. Science is evidence-based. That is why I love science with passion. Because you do it right, you get what you are supposed to get. Data will not lie. And if you think you are not sure, you repeat it. If it is not repeatable, if it is not reproducible, it is not the right procedure. So that is part of what we have to get used to as a country, especially with herbals. Do not be afraid to test your product. If you are afraid to test your product, it means something is wrong somewhere. There is a hidden agenda somewhere. I'm never afraid of testing, a sample, even if it is going to hurt me. Oh, I thought that this is going to be so. Then you check again, you look at your experiment, maybe your design is not correct. So what I'm saying is that anybody that is claiming a herbal medicine can cure COVID or herbal vaccine or whatever, they should come to us. Part of what we have done, NAFDAC has done in the past, is to look at the toxicity, because you cannot give something to somebody and the person dies. We look at the microbial content. But what I'm now trying to encourage us in NAFDAC is to go to the next level, to look at the chemical markers in these products, to also do clinical trials. We have hundreds of products in our database of herbal medicinal products in our database that were supposed to have been registered for 2 years and then they renew it and so on, but that should have been subjected to clinical trials. But people don't even understand. But that is part of our challenge, to educate our people about clinical trials. Clinical trials is not that I went to my village and I gave to 10 people and the 10 people got well. No, that is anecdotal evidence. If they got well, it is anecdotal. It's not based on design of an experiment. It's not passing through NAFDAC, is not passing through a National Health Ethics Committee on Research, NREC. It has to pass through us, especially if it is a finished product that somebody is going to use. If it doesn't pass through NAFDAC, it's not it at all. So we are encouraging now our people to come together in a meeting next week, to come together, actually to have a confidentiality agreement signed. Part of what some of the practitioners said is that, they don't trust this person, they don't trust that group. That I said, okay, I understand, you don't trust. NAFDAC will be a witness. And they even said that until NAFDAC gets into it as a witness, they will not work with anybody, which has been hampering us. We have lost billions of dollars. I'm talking of billions of dollars of medicines that we will have refined in terms of their quality, their safety and efficacy, and be selling all over. But we've not done that. We don't know how to protect our intellectual property. Intellectual property is what you thought of or what your great-grandfather was using and it was working for the family. Many of our grandfathers, grandmothers died with these gems, diamonds of knowledge. So part of what NAFDAC is trying to do, that I'm working at, is to bring these two together, sign a confidentiality agreement between themselves. We're going to put all this together, because without that, this suspicion of I don't want to work, will continue, jeopardize our progress in terms of herbal medicines development. Yes.
It's time we get you updated on NAFDAC updates.
Scientific analysis of semovita content shows no proof of plastic materials. The attention of the National Agency for Food and Drug Administration and Control, NAFDAC, has been drawn to a social media video showing a woman washing golden penny semovita in a sieve using cold water. The woman claimed that the residue she got after sieving was plastic. The Director General of the agency, Professor Adeyeye, immediately sprung into action to investigate the claim. In a telephone chat with NAFDAC and Your Health, she detailed the agency's response and findings.
I was bombarded from everywhere with golden penny semovita that is a rubber, that is plastic. People they want to kill us, and so on and so forth. And I am a scientist to the core. I called immediately. I've actually forwarded the WhatsApp image to the Director of Food Safety and Applied Nutrition. I called him in the evening. Tomorrow morning, first thing, with lockdown, go to the market and sample. And I called the Director of Food Labs tomorrow morning, start doing the test. That is what NAFDAC is all about. We are like police to safeguard the health of our people, because food can kill. So we ran the experiment, and of course, it has all the expected content. It has the carbohydrate or the starch. It has gluten. Gluten is about 12 to 13% of semolina. It has the vitamin A that is supposed to be added to it, So we got the expected components. No plastic was detected. Then what is causing the plasticity, or what is causing why does that person that did the video say that it is plastic? It is because the gluten or the protein that is in semolina is actually has two classes of proteins, glutenin and gliadin. The gluten, that is the combination of those two, is the one that gives dough the ability to rise when you want to bake bread. The gliadin, which is the second protein that is made, that adds up to gluten, gives it what is called viscoelastic property, or viscous and elastic property. So if you, for example, when somebody is making a dough, it draws almost like a plastic once it's finished rising. Yes. So the plastic, so you and I, you will call it plastic, but it is not plastic, it is elastic. So the gliadin gives it the viscoelastic property. So there is nothing plastic, meaning plastic like a plastic cup, plastic bucket, or no, there is nothing like that in semolina. So the advice is to let people know that all the semolina brands went through rigorous testing in NAFDAC labs. We take food very, very serious, because if you eat good food, you will not need a lot of medicines. We take everything very, very serious in NAFDAC, because it is what you and I eat. I cannot remove myself from it, from the picture. So if I'm eating semolina, I better be eating good semolina. And that is what NAFDAC is doing on a regular basis. We are science-driven regulatory agency. The companies were visited, inspected for good manufacturing practices, and we continuously monitor our companies. And therefore, members of the public who will be listening should be very careful in using social media to address any suspicion. They can always call us. They can always call NAFDAC. NAFDAC has changed a lot. We are not there yet, but we have changed a lot. We have an 800 number, 0800 623 322. Or they can email reforms@nafdac.gov.ng. All those things are on our website, but we will keep making sure that the public gets used to it so that they can send their complaints our way. Thank you so much.
That's it on NAFDAC Update. You've been updated.
This is where we wrap it all up on today's edition of the program NAFDAC and Your Health. Join us again same time, same station next week as we bring you another insightful edition. Remember, safeguarding the health of the nation is our collective responsibility. So report fake and unwholesome food and drugs and activities that create them in your area. You may have questions, comments, or inquiries. Kindly contact us. You can reach NAFDAC via toll-free numbers. For inquiries, call 0700 162 3322. For complaints, please call 0800 162 3322 or email nafdac@nafdac.gov.ng. Till next week, stay safe.